Hi, I'm Stuart Krelsham, Expedition Guide, Project Manager of the No Roads to Health project on behalf of the No Roads Foundation. In July 2012, we became aware of a health crisis in PNG. Progress of PNG's health status has declined continually since 1975 when it got its independence in Australia. Papua New Guinea has some of the worst maternal mortality statistics in the world. Women dying in childbirth doubled in Papua New Guinea between 1990 and 2008. The lifetime risk of dying in pregnancy for a PNG mother is 1 in 20. 1 in 12 children die before the age of 5. There are 10,000 paediatric deaths every year, and infants are twice as likely to die before the age of 1 in rural areas. To combat this, there is 1 community healthcare worker per 2,333 people. The long-term sustainable solution is to train local healthcare workers to go into these remote areas and to make a difference. But in the meantime, they need our support. So in November 2012, after fundraising, we gathered a group of healthcare professionals, doctors, nurses and midwives, and for 11 days we punched into some of the remote areas of Papua New Guinea and engaged with some of the local community healthcare workers and attempted to make a difference.
We are a small group of volunteer healthcare professionals who have come together under the No Roads Foundation banner with common values and have come up with the mission to partner with aid agencies to deliver targeted health activities to benefit the people of PNG. One of our main goals was to provide support and mentoring to a number of community healthcare workers who had been placed along the track in the last 6 months. These workers were relatively well trained but inexperienced and had not gained the trust of the people. We worked together and lived together, trekked together for 5 days, and we built up a rapport with these young men, reinforced their training by mentoring them, and increased their profile in the villages merely by our presence. Reports from the KTF and AusAid have acknowledged the success of the time spent with the community healthcare workers as a key measurable.
Midwifery care in PNG. Our initial assessment of the situation along the track was that it was well resourced medically and that maybe we'd misread the situation. However, through group conversations we gained the trust of the local village women. We then discovered there were a myriad of cultural and healthcare issues that were prohibiting these women getting the care they needed. We spent hours just sitting with the women, explaining the birthing process and giving them the knowledge to help themselves and recognise when to seek further midwifery care.
So if you're a healthcare professional with a passion to make a difference in a third world country and the ability to self-fund or fundraise, join one of our expeditions late in 2013 or throughout 2014 and beyond. I'll ensure that you experience some of the toughest parts of the Kokoda Track in some of the most beautiful and pristine environments of our world. You'll get to immerse yourself in village life and engage with the people like no other expedition can.
The No Roads to Health expedition will give you the opportunity to use your clinical skills to help these beautiful people who lead a very simple life but who are denied the very basics in healthcare.